Welcome to PreventScripts Decision Support Training. Hi, I'm Dr. Davis from PreventScripts. I'm here to show you how to quickly use our prevention assessment results and recommendation tool to get your eligible patients enrolled in one of the PreventScripts interventions. The patient assessment results on the top left of the report include 3 validated risk assessments and patient motivation level. Each survey with the asterisk reflects a validated survey instrument. Code each of these with 96160 with your super bill today. Here's a quick overview of these validated instruments and how to interpret their results. The ADA Prediabetes Survey is scored from 0 to 10. Anything above 5 is considered high risk for type 2 diabetes. The Patient Reported Outcomes Measurement Information System, or PROMIS, short form, version 1.0, General Self-Efficacy 4A, is a validated instrument that translates a raw score into a T-score. Self-efficacy is defined as confidence in one's ability to successfully perform specific tasks or behaviors. T-score distributions are standardized such that a 50 represents the average for the U.S. general population, and the standard deviation around that mean is 10 points. Therefore, a person with a T-score of 40 is one standard deviation below the mean. The PROMIS Adult Global Short Form, version 1.2, is a validated instrument that translates a raw score into a T-score. These results are broken into 2 sections, physical health and mental health. T-score distributions are standardized such that a 50 represents the average for the general U.S. population, and the standard deviation around that mean is 10 points. Therefore, a person with a T-score of 40 is one standard deviation below the mean. Knowing a person's T-score lets you know how this person compares to the reference population. For a more detailed overview of PROMIS interpretation, click on the link below and watch a 4-minute video from Nan Rothrock from Northwestern University. On the bottom left of the prevention assessment results and recommendation tool, you'll see our recommendation for a particular patient. Our algorithm uses the patient assessment results to decide upon the following recommendations with instructions. Some of these recommendations include clinical action, which I will note for you in the explanation. Option 1, not interested. This means the patient has indicated low motivation and is not interested in receiving any more information at this time about PreventScripts. There is no clinical action for this recommendation. Option 2, prevention emails. This means the patient has either indicated low motivation or has a normal BMI and has opted into receiving PreventScripts education emails. There is no clinical action for this recommendation. Option 3, refer to chronic management. These patients reported having a chronic disease. Of course, providers may opt to try a PreventScripts intervention for those with early disease or refer to a more intensive chronic care management program. Option 4, PreventScripts remote monitoring. These patients are overweight, vary in motivation from medium to high, and will remote monitor at home, tracking to improve biometrics such as weight, blood sugar, and/or blood pressure readings. Be sure to feel comfortable to give them a chronic disease diagnosis today to meet Medicare's requirement for RPM billing and document referral to the RPM intervention. The patient will be enrolled by downloading the app. Information about this should be hanging on the exam room poster. Option 5, PreventScripts prevention counseling. These patients are obese with high motivation and will be referred to the most intensive PreventScripts program with frequent visits according to the United States Preventive Task Force schedule, weekly for the first month, then every other week, etc. The patient will be enrolled by downloading the app. Information about this should be hanging on the exam room poster. Option 6, PreventScripts tobacco cessation. Patients who identify as tobacco users, have high motivation, and BMI under 30 will be referred to the tobacco cessation education program. The patient will be enrolled by texting PREVENT to the number on the exam room poster. This concludes the patient assessment results tutorial video. If you have any other questions or feedback, please feel free to email us at support@PreventScripts or check out the clinic support site from our homepage using password PreventSupport. Thank you.